has been in place for 75 years, and our vision was to ensure that we could build a facility that was going to meet the current needs of the hospital, of the community. And the community is currently sitting at 380,000 people, and so we needed to at least double the size of our hospital, was our thinking. Really, when we did the analysis, what we needed was a 300-bed facility to meet the needs of the community, and we needed new services like intensive care and cardiac services. There was a lack of oncology or cancer services in the area. And the final thing that we really wanted to introduce as a new service was rehabilitation. So the new project really enables us to continue all of our current services, but actually open up new services on a grander scale. So we talk about putting patients in an environment that make them feel comfortable and enable them to heal, and that for us meant that they're in a space where they feel comfortable, that there's an adequate amount of privacy, but there's also an adequate amount of natural daylight, because what we do know is that people can actually look out onto a view that's therapeutic and enables them to feel more positive about their health status and enable them to improve. So we have ensured that we have a lot of natural daylight in every patient treatment area, and that means that patients can feel very comfortable and have a great outlook and view, which we know makes people feel optimistic, and we know that that then makes people heal more than it would if they didn't have that. Well, and I think the same goes for staff as it does go for patients, is that people don't want to feel like they're working in a dungeon. And we have this wonderful opportunity with the design of the building, in that we can bring a lot of natural daylight and also allow there to be that view. And when you're a surgeon or a nurse working in a very defined area at very short location, the ability to put your neck up and look outside and see a view, actually that difference that your eye has to accommodate, that change, is actually very important and therapeutic in terms of your well-being and your ability to maintain your focus when you're dealing with a very defined area. So we certainly incorporated that within our design to make sure that our doctors and our caregivers feel very comfortable. And I guess, I always think that the happy caregivers will lead to happy patients because they're delivering great care. So that's our thinking and vision. Probably our most important stakeholder is our community, and I run a lot of community forums, but we're also going into aged care facilities and lifestyle villages, retirement villages, and actually telling them what we're doing so that they're remaining engaged, and they come up with fantastic suggestions. What are you doing about car parking? What are you doing in terms of the arrival and the foyer? Things that sometimes as healthcare professionals we don't think about, but from a community perspective they very much think about it. So we're linking very closely with our community. Other stakeholders, I guess, are our staff, our doctors, businesses within the communities, about how we can share and partner for products, having them involved in the construction on site, dealing with education facilities and making sure that they're employing the sorts of people that they're teaching and training the sorts of people that we can employ in our hospital, because that sort of builds a very strong community, and a strong community will deliver great health care. The biggest challenge for the team on site is the fact that we've got an operating hospital in one location, and then we're planning and building another hospital, and quite often when people do greenfield it's a whole new team. The balance of trying to manage our time and our priorities of running one hospital but building another has been a challenging period for us, but I think it actually means that we'll be well placed to allow the commissioning of the new hospital to actually move through quite seamlessly. So that's the advantage. Other challenges, I guess, is always budget. It's always the time frames, because you want to deliver. You think if you're building a new hospital that you can spend your time and create something absolutely spectacular, and I think we've done that, but there's always a time constraint, and time means money in construction, so we've had to be balancing those two priorities, but I think we'll do well. tender is released. So there's a lot of very keen builders within the room today who are interested to see that tender as it comes out. And that will enable us to choose a builder best equipped to be able to deliver this project. That will commence in a month or two. So we know that there's about an 80-week construction time. So that's really my next 18 months is overseeing and leading that construction period. And probably in the next 6 months we'll start thinking about commissioning how we're going to relocate services. So from a patient perspective, it's at one hospital one day and the next day we'll be delivering care from a new hospital. That's going to take a lot of time and a lot of planning to make sure that's seamless. So that will very much keep us busy.